Good afternoon, everyone. I'm Brian Beamish, Ontario's Information and Privacy Commissioner. Thank you very much for tuning in. In this webinar, we'll be talking about the Personal Health Information Protection Act, or PHIPA, and requirements for notifying our office when there has been a breach of personal health information. In the next hour, we'll cover privacy breach situations that healthcare providers might face, as well as the ins and outs of reporting them to the IPC. Our goal is to help you understand the types of health privacy breaches that must be reported to our office. We also want to get you ready for the new annual statistical breach reporting requirements for the healthcare sector that take effect in March 2019. We're going to start things off with a brief recorded presentation. Following that, Registrar Suzanne Brocklehurst and our Director of Health Policy, Deborah Grant, and I will answer your questions. Don't hesitate to send in your questions while you watch the presentation using the Q&A function on the right hand of your screen. Now, we should have close to 300 people registered and participating, but we'll do our best to get to as many questions as you can. Your questions are anonymous. You won't be identified when you read them, and other participants won't see them. Just a reminder that following the broadcast, the presentation and Q&A will be available on our website and on our YouTube channel. So let's get things underway with the presentation. You may need to turn up the volume on your computer because the video will be played through the computer. And we'll talk to you after this is over.
Welcome to the IPC webinar, Reporting Health Privacy Breaches. The Office of the Information and Privacy Commissioner of Ontario oversees Ontario's privacy and access laws. This includes the Personal Health Information Protection Act, or PHIPA, Ontario's health-specific privacy legislation. Personal health information is sensitive. People are protective of personal details related to their medical conditions. At the same time, healthcare providers need this information to care for patients. PHIPA governs how personal health information is collected, used, and disclosed, creating a consistent approach to protecting health information across the health sector. Under PHIPA, health information custodians must notify the IPC of a theft, loss, or unauthorized use or disclosure in the circumstances set out in the regulation. Before we move on to the specifics of situations where you must notify the IPC of a privacy breach, a few words about your duty to notify. Under PHIPA, health information custodians are required at the first reasonable opportunity to notify individuals whose personal health information has been stolen, lost, or used or disclosed without authority. Even in cases where you are not required to notify the IPC about a privacy breach, you have a duty to notify patients. When patients are notified of a breach, they must also be informed of their right to file a privacy complaint with our office. The regulations under PHIPA set out 7 different categories of health privacy breaches that must be reported to the IPC. They are use or disclosure without authority, stolen information, further use or disclosure without authority after an initial breach, a pattern of similar breaches, disciplinary action against a college member, disciplinary action against a non-college member, and significant breaches. These categories are not mutually exclusive. In some cases, a single privacy breach may fall into more than one of the 7 categories. Let's explore each of these breach situations in more detail. When discussing privacy breaches involving personal health information, it is helpful to first define use or disclosure without authority. Use or disclosure without authority is when personal health information is used or disclosed without consent for purposes not permitted by PHIPA, or for purposes not permitted by the health information custodian. This can happen when someone who is not involved in a patient's care intentionally looks at an individual's personal health information without a work-related purpose. In some cases, the person snooping in the file could also share the private details they have learned with others. Snooping can be motivated by interpersonal conflicts, curiosity, personal gain, or concern about an individual's health and well-being. Regardless of the motivation, deliberate unauthorized use or disclosure must be reported to the IPC. This is not the case when personal health information is accessed accidentally. Examples of this include emailing patient information to the wrong person by mistake, or placing a letter containing patient information into the wrong envelope. When one-time errors like these occur, you generally do not need to notify the IPC. Unfortunately, some of the most common privacy breaches happen not only when personal health information is lost or mistakenly disclosed, but when it's stolen. A privacy breach resulting from a theft of information is very much as it sounds. Someone has stolen paper files, a laptop, or other devices containing personal health information, or the theft of information is the result of a malicious software attack. These privacy breaches must be reported to the IPC. An exception is when the information that has been stolen is properly encrypted or de-identified to prevent attempts to gain access to the records or identify patients. When information has been protected this way, you do not need to report the breach to the IPC. After a privacy breach has been discovered, additional details concerning the breach may come to light. You may find out that the information from the initial breach has been or will be further used or disclosed without authority. An example is an employee snooping in patient files for the purposes of health care or insurance fraud or marketing services to patients. Or when someone accidentally receives a fax containing confidential patient information and then threatens to make it public. In these situations, even if you do not report the initial breach, you must report the situation involving further use or disclosure to the IPC. Sometimes a breach might not seem particularly significant. For instance, think back to our example of faxing a document to the wrong recipient, or accidentally mailing patient information to the wrong person. Mistakes happen from time to time, and on their own, these incidents don't seem to be cause for alarm. It becomes a problem when the same breach issue keeps happening, indicating a pattern of similar breaches that should be reported to the IPC. That's one of the reasons why it's so important to keep detailed breach records. By keeping track of all privacy breaches using a spreadsheet or some other means, it's easier to detect any breach patterns. And once you determine a pattern of privacy breaches is occurring, you must report this to the IPC. You should also take steps to address a pattern of similar breaches. For example, you may need to provide additional training for staff or tighten up the work processes that are allowing personal health information to slip through the cracks. Tracking all the breaches will not only help you discover breach patterns, it will also help you when it comes time to report your annual privacy breach statistics to the IPC. Reporting these statistics is something we'll talk about in a bit more detail later. In some cases, a healthcare practitioner may be disciplined by an organization they are working for because of a privacy breach. This could include revoking, suspending, or restricting the privileges of a physician. The healthcare practitioner may also choose to resign on their own for reasons that appear to be related to the privacy breach. In situations where you are required to report a healthcare practitioner to the regulatory college because of a privacy breach, you must also notify the IPC. This reporting requirement also applies to healthcare practitioners employed by a board of health. Not all employees with access to personal health information are members of a regulatory college, but similar reporting requirements apply. In the event an unregulated employee is disciplined because of circumstances related to a privacy breach, or they quit and you suspect it is related to the breach, it must be reported to the IPC. So far, we've summarized 6 health privacy breach situations that must be reported to the IPC. Those involving use or disclosure of information without authority, stolen information, further use or disclosure without authority after an initial breach, a pattern of similar breaches, disciplinary action against a college member, and disciplinary action against a non-college member. Most privacy breaches will fall into one or more of these categories. However, if they do not and are otherwise significant, they must be reported to the IPC. In deciding whether a privacy breach is significant, these questions should be considered. Is the information sensitive? Does the breach involve a large volume of information? Does the breach involve many people's information? And is more than one health information custodian or agent responsible for the breach? These are all factors to consider in deciding whether a breach is significant. In general, privacy breaches involving sensitive information that has been made widely available must always be reported to the IPC. Now that you've heard about the 7 types of breaches that should be reported to the IPC, you may be wondering about how to do that. Although you can report breaches to us by mail or fax, we recommend that you use the breach reporting form on our website. It is available by accessing the Health tab on the professional area of our website, choosing Report a Privacy Breach, and then selecting Privacy Breach Report Form from the menu on the left. You'll be asked to provide a description of the breach and the date it happened. You'll also be asked to provide a summary of the steps taken to contain the breach, notify individuals, and investigate the cause. These details can be provided later if they are not available at the time you report the breach. Take care not to include any personal health information in your report. Once we've received your report, someone from our office will follow up with you. You may be asked for additional details about the breach, and the IPC may recommend preventative measures to prevent further breaches. And while we're on the subject of reporting, as mentioned earlier, starting March 1st, 2019, health information custodians will be required to submit an annual report of all privacy breaches occurring in the previous year, beginning January 1st, 2018. When submitting this annual statistical report, you must include all thefts, losses, or unauthorized uses or disclosures of personal health information. This includes health privacy breaches that do not meet the mandatory reporting criteria described in this presentation. When you tally up your breach stats, make sure you don't count each incident more than once. Choose only one reporting category that best fits. For more information on annual reporting and health breach statistics, visit the Health section in the professional area of our website. As a general principle, you may not need to report a breach of personal health information to the IPC at the time it occurs or is detected if it was not intentional, it is a one-time incident, and it is not part of a pattern of breaches. But remember, even if you don't have to report a privacy breach to the IPC, you always have a duty to notify the individuals whose personal health information has been breached and to count all breaches in your annual report. You can visit our website for more information and resources on protecting personal health information and other access and privacy topics. And be sure to subscribe to our YouTube channel for all of our latest videos. Thank you for joining us today. We hope you found this presentation helpful. The IPC is committed to working with healthcare providers to protect patient privacy and improve accountability and transparency in Ontario's healthcare system. Contact us if you'd like additional information about this topic or if you have any questions about access and privacy.
Welcome back, everyone. There were some important points covered by that presentation about health privacy breaches, and there may be some areas where you would like clarification. I'm here, as I mentioned, with our registrar, Suzanne Brocklehurst, and our Director of Health Policy, Deborah Grant, and we are available for the next 40 minutes to answer any questions that you have. Just a reminder that they can be submitted by clicking on the Q&A portion on the right-hand side of your screen. One question that we've had and that we're often asked when we're out speaking relates to what HICS should do if a staff member opens the wrong patient file by mistake. In this, a typical situation would be where a staff person is going to trying to pull an electronic file on a patient and accidentally clicks the wrong file. quickly realizes that they have the wrong patient and closes the file out. The question is there a responsibility to notify the patient? Is there a responsibility to notify the IPC? And should it be counted as part of the annual privacy breach statistical report? And this is an issue that we have talked about a lot internally. And our view is that if it was truly an accidental entry to the file, that there is no need to notify the patient or the IPC, and therefore no requirement to include this in the annual privacy breach statistical report. But it has to be a truly accidental entry to the file. For example, the staff member may have selected the wrong family member and quickly realizes that mistake. They may click on the wrong patient on the index list and again realize it's the wrong patient, quickly closed it out. In those cases, we would not consider that a reportable breach either to the patient or to the IPC. But I want to distinguish that from situations where, in fact, the entry to the file can't be considered to be accidental. For example, if the staff member opens up a file of an individual with a high profile in the community and is in the file for a couple of minutes, I think you have to question whether that, in fact, was accidental. Similarly, if the staff person is repeatedly seems to be clicking on the wrong file, again, I think you have to question whether that's accidental, and in those situations, you may well be required to report that breach to the patient and to the IPC. Another question we had is whether the new reporting regulation will apply to municipally run ambulance services in Ontario. And maybe, Deborah, I can get back to you.
Sure. Thanks, Brian. The breach reporting requirements apply to all health information custodians under PHIPA. And those custodians are defined in Section 3 of PHIPA. And one of the categories is an ambulance service within the meaning of the Ambulance Act. So ambulance services would have to have an annual report to the IPC and report immediately if a breach falls into one of the categories set out in the regulation.
And Deborah, just a follow-up question, very similar to that one. Do dentists have to do the annual breach statistical reporting? And based on your answer there, I assume yes, the dentists are HICS, and all HICS are required to do the annual reporting.
Yes, that's correct. As health information custodians under PHIPA, dentists would be required to do an annual report of their privacy breaches.
And another question that has come in, and again, this is one that we're frequently asked when we're out talking to groups, and some HICS will tell us that they have advanced monitoring technology that is capable of doing audits and discovering breaches. And as a result, they are discovering a fairly high number of breaches. And there is some concern that when they file their annual statistical report, they may be identified by name, and that may look bad on their organization. So the question is whether, starting in 2019, will we be identifying HICS by name in the annual statistical breach reporting? And the answer to that is that our decision is that we will not be, at least for 2019, identifying HICS by name. That we'll be using that annual statistical reporting information to try to get an overall picture of frequency of breaches, the scale of the breaches, and the types of breaches that are occurring across the province. That will give us a better sense of how breaches are occurring and what kind of assistance we can provide in terms of additional guidance to HICS, so that we would not be intending to do a HIC by HIC identification of numbers of breaches. It is important, though, to recognize that there are other ways that HICS might be identified relating to the number of breaches they've had. For example, it's possible that someone might put in an FOI request if the HIC is also an institution under FIPA or MFIPA. asking for the number of annual breaches, and in that case, the HIC may well have to disclose the number of breaches they've had. But in general, it's not our intention to identify HICs by name in our annual report. We've had another question that I can either give to Suzanne or Deborah. And the question is a ransomware attack considered to be a breach?
I can take that one. Ransomware attacks can be a breach if the proper measures aren't in place and there has been some access or disclosure to the information at issue. It really is dependent on the circumstances. We have found in some cases that there was not a breach because proper measures were taken by the HIC to prevent any access or further disclosure of the information that the HIC had in their possession. Do you have anything?
Just that we do expect them to report ransomware to our office.
Yes.
So that we're aware of what's going on across the sector.
Right.
Yeah, that's a good point. Deborah, maybe I can get you to answer this question. If you have a privacy breach with a patient, but you do not have that patient's contact information, how would you deal with that situation?
Okay, well, custodians are required to notify the individual when there is a privacy breach. But of course, you can use any method you can to notify the individual. The legislation doesn't say how you have to notify the individual. So if you don't have any contact information at all and you're unable to reach out to the patient, you may just want to put a note in their file and notify them when they come in for their next appointment. The legislation does say at the first reasonable opportunity, and if that's the only way you can notify them, that would be the most reasonable opportunity to do so.
Great. We have another question that came in. If a significant breach occurs involving more than one patient, do they need to be reported separately or as one incident? And I think our conclusion on that is that that should be counted only as one incident. In terms of the annual breach reporting requirement, don't double count, simply report it as one incident. But in the report, I believe we're asking for the number of individuals affected by breaches. Suzanne, is that right?
Yeah, that's right. We would want to know how many individuals were affected to make sure that the proper notifications to those affected people were taken.
Yeah, if you look on our website, you will find the guidance on the annual reporting of privacy breaches, and you'll see exactly the type of information that we'll be looking for in 2019. Deborah, another question for you. In respect of the 6th mandatory notification situation, is it meant to apply to paramedics who work for an ambulance service provider?
Okay, the legislation puts the duty to report to the commissioner on the health information custodian. So it's the health information custodian who's required to report, and I'm not sure in the situation described who the custodian would be, but the custodian is the one who's obligated to report.
Right, and the 6th category is discipline against a non-college member. So yes, that would apply to someone working for an ambulance service provider.
If they're not regulated and they're working for a service, an ambulance service provider, yes, that would apply.
Great. Suzanne, maybe I can have you answer this one. And in your role as our registrar, you're the one who receives all the breach reports that come in. So could you tell us what happens when a HIC reports a health privacy breach to the IPC, and when a HIC can expect to hear from the IPC?
So we encourage all health information custodians to report their breaches through our online reporting tool. However, you can also report breaches to our office by fax or by mail. We generally will respond formally to your report to our office. Within about 2 weeks, you'll receive a formal response from us, which will include a list of questions that we will have about the breach. If you haven't already answered those questions, we would appreciate receiving a report in answer to the questions that you haven't already provided us information about. In general, what we're looking for when you're reporting a breach is the nature of the breach, the measures you've taken to contain it, any outreach to notify affected individuals, and the steps that you believe will be taken to prevent a future occurrence. The majority of reported breaches are resolved without a formal order by our office. However, if the matter is not resolved at an early stage, it could be further investigated or adjudicated and result in a public decision.
Great. We have another question related to the annual statistical report. And the question is, for that statistical report, do we need to report PHI that was faxed to the wrong HIC? And the answer to that would be yes, that should be included in the annual statistical report. However, generally speaking, misdirected faxes are not the type of breach that we think should be reported to the IPC at the point where it happened. So it doesn't reach the threshold of the mandatory reporting regulation, but it should be included in the annual statistical report. And again, for that annual report, we were asked, is there a template or form on our website that we can use? And yes, there is. You will, as I mentioned, you will see a document setting out what our expectation is for the annual statistical breach report. And it will set out the categories that we will be expecting to collect information on. I think they're very straightforward. I can tell you that early next year, early 2019, we will also have a portal that HICs can file that report through. And that will be familiar to all HICs who are also institutions under FIPPA or MFIPPA. They already use a statistical reporting portal to give us the stats. We'll have something similar set up for HICs early next year. Question for Suzanne, maybe. This is an interesting one. What happens if HICs don't report?
That's a tough question. I'm not sure what the intention of the question was. However, it's important that health information custodians do report to our office, because if a patient becomes aware of the breach and it's not reported to our office, they can report it as a complaint, and we'll open it up, and it could be investigated, and the fact that the health information custodian didn't report it when they ought to have can be part of our analysis in determining how we deal with the breach.
Right, and you make a good point that there are many ways that patients might come to learn of a breach. And if they contact our office and it turns out that the HIC had not reported that as they should have under the mandatory requirements, that could end up being quite embarrassing to the HIC.
Yes.
And also, as you point out, the vast majority of breaches reported to this office do not end up in any kind of a public report. I guess one way to ensure that it does end up in a public report is your failure to comply with the mandatory breach requirement. Deborah, a question for you. If a HIC is notified that information disclosed to a patient's legal counsel has been further disclosed to another party, is this a reportable event?
Well, the duty is not on the custodian. Once custody or control of that information is given to some other person, the duty to report is not on the custodian. The custodian only has to report breaches relating to personal health information in their custody or control. However, this I'm assuming that the disclosure to the patient's legal counsel was authorized by the patient, and as a recipient of personal health information from a health information custodian, that legal counsel has duties under the legislation as a recipient of personal health information, and they're only supposed to use it and disclose it as in accordance with the consent that was provided or for some other legal purpose. So I'm not sure exactly if that answers the question or not. If not, you'll have to ask a different question, but generally I wouldn't say that the custodian is required to report that kind of a breach once it's been disclosed to a third party already.
Right, and there are lots of legitimate reasons for a patient's legal counsel to disclose to someone else, right? They may be required as part of a discovery process. It is the patient's legal counsel, so the patient may direct legal counsel to disclose their information to someone else. So it may well be done with the patient's consent. Good. If a staff or agent access information when investigated, claim they had verbal consent and are later able to provide written consent after the fact, is this considered a breach? Deborah, maybe I'll toss that over to you. It seems to me that the written consent after the fact is not ideal. I suppose it may suggest that in fact verbal consent had been present, but
well, the fact that you're investigating the situation at all, to me, suggests that there's something not right in the way the information was accessed by the agent. So it depends on what the custodian permits. For example, if you have an electronic health record in your organization, it's probably only for healthcare purposes. So if that person is not providing healthcare to the individual, you wouldn't expect them to be accessing someone's information, even if they have the consent of the individual. So it depends on what the custodian permits. And in general, if it's not for a healthcare purpose and you're investigating, it suggests that this is not something that the custodian has permitted. And even if they can produce the verbal consent is only one of the conditions. It would also have to be something that's permitted by the custodian.
Great. Suzanne, maybe I'll ask you about this scenario. One of our expectations when health information goes astray is that the HIC contain the breach by getting the information back. But what would we expect a HIC to do regarding containment when it is the result of a third-party theft and the records cannot be recovered?
In those situations, for example, if someone has left personal health information in their car, whether it's paper or on a laptop, it's stolen, they can't retrieve that information, we would expect that they would notify police to make sure that if the information does come back, it can make their way back to the person. We understand that there's not much else you can do beyond that. However, notifying the patient whose information has been stolen is very important, so they are aware of that incident.
And there's also a role that this office can play as well. I'm thinking of a recent case we dealt with where a patient took a screenshot of a physician's patient list and refused to return it. And in fact, our office ordered that patient to destroy it and provide us with an affidavit that they had destroyed it. And when we didn't get that satisfaction, did file a contempt motion. Thankfully, that has been resolved, and the patient finally did provide us with that affidavit. They had destroyed the stolen information, and we didn't have to continue with the contempt motion. But we can play a role if you find yourself in that scenario in trying to, in that case, you know who stole it. But if you're having difficulty retrieving stolen information, I encourage you to get our office involved. We've had a number of questions regarding the misdirected fax and misdirected faxes. And just to clarify, our view is that in the case of a misdirected fax, it is a breach that would require patient notification and would require inclusion in the annual statistical report. But unless there are other extenuating circumstances would generally not require immediate notification to the IPC. Is that, Deborah, Suzanne, that's pretty consistent with what we've said?
Yes.
Okay. Deborah, maybe I can ask you about this one. Is sending PHI through unencrypted email between parties a breach? And I know there's a very nuanced response to that question.
Right. So we do have a fact sheet that we issued on the topic of email, communicating personal health information via email. And basically the position that we've taken is that if you're communicating one custodian to another custodian, a healthcare provider to healthcare provider, that information, personal health information, should be encrypted. However, when a custodian is communicating with patients, it may not be possible for both parties to have an encrypted email system. So there are circumstances where you would be permitted to communicate personal health information via unencrypted email to a patient. You should take a look at our fact sheet because there's a number of considerations. Of course, we would expect you to practice data minimization and to have all the safeguards in place that you would have for any personal health information. So there's a lot of details in that fact sheet, and I don't think I'm going to get into them here, but I would refer you to that.
Yeah, that's a very difficult issue, and as I say, it is pretty nuanced, but good advice to refer to our fact sheet. And you could also use the info IPC line if you have any questions about that as well. Suzanne, we had another question about the statistical report, the annual report. If PHI is disclosed without authority, how would we expect that to get reported in the statistical report for something other than a fax or email? For example, is there an other option?
I'm looking at the categories, and there isn't an other option, but there is a category for used without authority, and I see that here we have electronic and paper. That may be something that we'll need to relook at and have an other category. That's a good point for us to look into.
Yeah, I think what we after this will be 2018 will be the first year for which we're collecting the statistical report. We'll certainly sit down after we get the reports in early 2019 and review the categories and the types of situations that we're asking for details on, and see if there are some gaps that we need to fill.
And I think in that situation, you need to give us the total number of breaches where they relate to a use without authority, and then it needs to be further broken down into through electronic systems or paper records, and then we would assume that there's additional, if there are additional in that category, that they would be in the other category.
Right. We have a question that either Suzanne or Deborah might want to weigh in on. If a HIC becomes aware that a regulatory college was notified of an incident as a result of a police investigation of their agent, and that was also uncovered a privacy breach, does the HIC have a secondary obligation to report to the IPC along with the police? I'm not sure. I think as I understand that the HIC finds out that the police have reported an agent to a regulatory college for what is also a privacy breach, it seems to me the HIC would have an obligation to report that to the IPC, whether or not the police have.
Yes. Although it may not fall in the category where you're reporting the incident to the regulatory college. Someone else has reported it to a regulatory college, but you're becoming aware of a serious breach, obviously, and I'm sure it would fall within one of the categories for reporting of the breach requirements.
Okay, Suzanne, maybe I can ask you to answer this. We've talked about misdirected faxes, but what if the PHI is disclosed via regular mail or a courier. In other words, a letter goes misdirected, or a courier package gets delivered to the wrong address. I think that would be handled the same way as the misdirected fax, wouldn't it?
Yeah, we would deal with that in exactly the same way.
So that would be yes, notify the patient.
Yes.
Yes, notify included in your annual breach reporting statistics, but absent any extenuating circumstances, no duty to immediately contact the IPC.
That's right.
Deborah, maybe I can ask you this one. If an insurance company has a breach of a medical file, must it be reported to the health custodian who originated the file? And would the health custodian in return need to report that to the IPC?
First of all, there's no duty for a recipient under PHIPAA to report a breach to the custodian. And but if the custodian did become aware of it, they could report the breach to us. There's no obligation for them to report such breaches. However, we could investigate the insurance company as a recipient under the recipient rule, Section 49. Yeah, there's no obligation for the recipient to notify the custodian of the breach. However, if the custodian did become aware, they could report it to the IPC, but there's no obligation to report.
Right, and interestingly enough, if I'm not mistaken, there will be mandatory breach reporting under PIPEDA coming in shortly, which would cover the insurance company.
Right.
So at some point, they presumably are going to be covered by some type of mandatory breach reporting requirements, albeit not PHIPAA.
Right.
Good. Another question about misdirected faxes. This HIC says that if they're the recipient of misdirected faxes, that they will notify the sending facility that they've received a misdirected fax containing confidential PHI. There is no guarantee that the sending facility will report these in their IPC stats report. They're asking, is this a waste of our time doing this? And it seems to me it's definitely not a waste. It sounds like a responsible thing to let a sending facility know that they have misdirected it. If they are a HIC, hopefully they will include it in their stats. Suzanne, maybe you can answer this or respond to this. I think we are often contacted by recipient HICs who are receiving misdirected faxes.
Absolutely, and we would want to know about those because it could inform us that there's a pattern of breaches that we should be notified on. And we always get in touch with the HIC who's sending the faxes to determine if their fax machine is working properly and if this is an isolated incident or not.
Great. Deborah, maybe I can ask you this, and we've been asked this question, and it also has come up in the past. What if a HIC discovers a breach that occurred before October 1st of last year? In other words, it occurred before the breach reporting requirement came into effect. Should that still be reported to the IPC?
Yes, it should. If you discover a breach now, however, the breach occurred before the breach reporting requirements came into effect, if that breach meets the criteria set out in Section 12.3 and the regulations for immediate reporting to the Commissioner, we would like you to report that breach when you've discovered it. Regardless of whether you're required to report the breach to the IPC immediately, we would also like you to include that breach that you've discovered in your annual report for that year as well.
Great. Now we've been asked another one of these questions where I think the answer is a bit nuanced. Category 4 of the mandatory breach guideline or breach regulation talks about the need to report a pattern of similar breaches to the IPC. And the question is, what do we consider a pattern in order for it to be reportable? I think if you look in our guidelines, we make the point that this is really a question of judgment on the part of the HIC. It's difficult to put a numeric number on what constitutes a pattern. That the HICs really need to look at the number of times they receive it, the time in between the breaches occurring, the number of patients involved. There are a lot of different factors that would go into what constitutes a pattern. Deborah, do you have any?
Yeah, even like two incidents close together, if they're serious incidents, that could be considered to be a pattern. You have to exercise your discretion in determining that. But if things happen repeatedly, for sure that's an obvious pattern. But if something happens one or two, couple of times, you may not want to wait for the third time to report it. You have to use your discretion in that.
Good. Okay. So this maybe Suzanne, I can ask you to comment on this. What details will be required to be reported to the IPC in the annual statistical report? What information should we be prepared to report? And again, I think you've made reference to the guidance that we've made available on our website.
Yeah, you should have a look at the guidance on our website. It breaks down the categories that you'll need to report to our office and how you need to report, break it down further into the number of affected individuals. And the categories that it's broken down into are breaches where personal health information was stolen. And then the second category is where personal health information was lost, where it was used without authority or disclosed without authority. And then for each of those categories, it's broken down further, but it's clearly laid out in the guidance document.
Great, and that guidance document is on our website and for folks to look at. It's a good question. What would this circumstances be where an immediate notification to the IPC is necessary for a misdirected fax or email or regular mail? And I can think of a number of situations where the mandatory reporting requirements might be met. I think you would want to look at the number of affected individuals. In other words, did the fax or the communication involve a lot of patients? Was it sent out to a lot of recipients? And you might also want to look at the sensitivity of the information contained in the communication, and that by itself may require notifying the IPC. Deborah?
Also, if you think it's a part of a pattern of similar breaches.
And also, if you're unable to contain the breach, you should definitely notify us so we can assist you with that.
Suzanne, I think this is a situation we have dealt with. What if the breach involves a deceased patient and no substitute decision maker is on file? And ask the reasonable question, how do we notify at first reasonable opportunity if the patient will never be seen again?
That's a tricky question. I think what we would generally expect, and similar to what Deborah has already communicated, is that you make a note in the individual's file. If at any time someone does come forward to administer that person's estate or to look after their health records, then it would be appropriate at that time to notify.
Okay, great. We talked about PHI being disclosed in error and the need to retrieve the information that's been disclosed. One viewer is asking, recognizing that you need to notify the patient. However, what actions should be taken with the information that was received by an incorrect recipient? And how do they confirm that the information was destroyed by the incorrect recipient? This is a question we've dealt with. I guess there's a need to get some type of assurance in one form or another that is verifiable or trustworthy that the information has been destroyed. I mentioned that when our office gets involved, at times we will ask for an affidavit from the recipient that they have destroyed it. I suppose you could also ask the individual to send it back so that you can verify that it's been destroyed.
And best
Suzanne,
practice,
what's your experience
I would
on that?
say best practice is that you send someone out to get the document or the information they've received inappropriately, someone from your office or a return courier. That way, it's not, the onus isn't on the individual to send it back or to return it to your office.
Right, but if you have any doubts about whether they're retaining a copy of the information or they're not going to return it, you can always contact our office and we'll try to give you some assistance there.
Right. We've had a question about the issue that comes up quite frequently, where a lab will send lab results to a physician to a location where the physician is not working anymore, and the physician's office has not informed the lab that the person's not there anymore. The lab gets the results, sends it to the wrong address. The question is, should this be reported to the IPC? Deborah, maybe I can get you to comment. Off the top, it sounds like it probably is not reportable to the IPC unless it starts to fall into it becoming a pattern.
Yeah, I wouldn't think that it would fall under the first criteria, which is unauthorized disclosure of the information, because it's not unintentional unauthorized disclosure. So I would say that that is not something that has to be reported to the IPC. It might be something that you want to notify the individual about or include in your annual statistical reports, but I don't think we need to hear about that immediately.
Right, and this is a case where although the lab report is misdirected, it's been misdirected to a physician's office, albeit an office where the physician is no longer working, so that in terms of impact of the breach, it probably doesn't reach the level of significance. Suzanne, another one on the breach, on what constitutes a breach. The question is, what if the breach only contains the patient's name, date of birth, and address? Is this considered a reportable breach?
Depending on the nature of the breach, saying it is, say, an unauthorized disclosure, it would be a breach because it's indicating that that person is receiving health care from your organization.
And it does include personal health information. Yeah. So if it meets the criteria for reporting, then you would have to report it, yes.
Right. Deborah, the question is, for statistical reporting or reporting to the IPC, if another HIC is contracted by a HIC and they commit a privacy breach, what are they expected to report annually on this breach or report to the IPC? Or would the HIC that contracted the HIC report on? I guess the question is, a HIC is working for a HIC, the first HIC has the breach, who reports it?
Well, if you're working for a health information custodian, you're considered to be an agent of the custodian. So in that respect, you're not a custodian. You're not the custodian of the information. So I'm not exactly sure what the scenario is, but if you're doing something on behalf of a custodian, you are an agent of the custodian as opposed to being a health information custodian. For example, if you're a healthcare practitioner working for a hospital, you're not in that particular context a health information custodian on your own. You're an agent of the hospital.
And the health information custodian, the hospital, would be required to report to our office.
Okay, great. We're getting ready to wrap up. I wanted to reiterate that we will be sending links to all the guidance documents in the webinar to all participants. They are available on our website. And this presentation, the recorded presentation in the Q&A session, will also be available on our website and on our YouTube network as well. I apologize if there's some questions we haven't been able to get to. One final one, we are the recipient of a misdirected fax. Do we need to include it in our annual report? And I think the answer to that is no, that it's only the sender of the fax that should be including it in the annual report, not the recipient. So with that, we are going to wrap up. I want to thank Suzanne and Deborah for their assistance in answering your questions. Thank you to all of you who participated, and thank you as well for all of those questions that you sent in. They were great, and I hope this has been of assistance. Thanks again. Bye-bye.